So what we're going to chat about today is massaging your Yahoo. So really what we're going to be chatting about is tips on how to prevent vaginal tearing, aka the tearing of your perineum. So I'm going to use this shell today as a demonstration of what your perineum is and why it is so important to be aware of it if you're giving birth. So a lot of folks do tear their perineum during birth. Basically, your perineum is the area right below your vagina. So this, I know it's very large for vagina, but imagine it's the vagina. And then your perineum would be right here, the skin between your vagina and anus, and then your anus would be below. So some folks, when they give birth, their baby's head is just too big, and as a result, they tear their perineum, which is right below the vagina. They have to get stitches. A lot of folks are afraid of that, and it can be painful, obviously, so you do want to take preventative measures. And so today I'm going to go through some tips to be aware of that. Tip number one is to really be aware of pushing. Basically, you don't want to have constant expulsive pushes. You really want to have calm pushes, guided especially by your contractions, and guided with breathing, and really making sure that it's something that you are actively being mindful of, or at least someone else is actively being mindful of, so that your provider can guide you through and that your body has time to change and stretch as your baby is coming. That way you're not just constantly like pushing forward, and that way you're not at risk for having this tearing. So tip number two is to keep your perineum warm. So as I mentioned, your perineum can often tear, but if it's warm, then it can help stretch. So very similar to stretching other muscles. If you go into a sauna or anything like that, the heat helps with dexterity and allows for your body to move with it. So if you place a warm towel on your perineum, then it allows for that flexibility and dexterity so that it can stretch as your baby's head is coming out of your vagina. You can just place that warm towel there when you're in the second stage of labor, and that may help as you're preparing so that your muscles are ready and the skin is ready, and it can help prevent tearing. Tip number three is to deliver in an upright, non-flat position. So a lot of times in media, we see moms give birth like this, and their legs are up here and they're pushing out, and that squatting position is good, but if you're in a flat position, it's actually not as inclined for birth. So I've spoken with doulas who have gotten an epidural or anything like that, and obviously in those cases you may have to give birth on your back, but in certain cases, if you don't want to, or if it's uncomfortable for you to lay down right on your back, then you can actually turn on your side, and that may even be more beneficial than just giving birth laying straight down. So if you want to think of a proper analogy, if you think about things like pooping, it's kind of unnatural for someone to poop lying down, right? You want to be sitting on a toilet, gravity can do its thing. If you're squatting, a lot of people have squatty potties or little stools to help them be in a squatting position so that gravity can help your poop move along. So similarly, birth can work most efficiently if you have gravity helping you. So that's why some folks give birth standing up or in a squatting position or anything like that. Obviously, it can be difficult if you're receiving an epidural or anything of that nature. But for instance, I remember in Shay Mitchell's celebrity birth video, she does a lot of upright positions, and this can definitely be more helpful. It's just more natural for your body and allows your baby to just be pushed along, so it can help prevent that tearing from happening. A quick caveat and fun fact is that Louis XIV may actually be responsible for so many women giving birth on their back. If you think about movies or TV shows and any depictions of birth, typically they are on their back, and a lot of people theorize that this is because Louis XIV had somewhat of a fetish for his mistresses and baby mamas and everything like that giving birth on their back. Basically, he just really liked the aesthetic of it, and so they gave birth that way. But obviously, he was not science-backed or following the principles of evidence-based birth. So that is just something to be aware of. You don't need to give birth as Louis XIV wanted it. You don't need to give birth like you see in movies. You want to give birth in a way that feels comfortable for you and is also guided by science and provider-oriented recommendations. And of course, your wishes should be the priority, but you definitely want to have an informed experience. So this is some information that could help. Hello, Anja Angels. My name is Kathryn. I am the founder of Anja Health. So I wanted to personally thank you for watching this video. If there were any specific moments that you liked, then we ask that you comment the timestamp of that moment in the comment section. And of course, like and subscribe if you like this video. We have a ton more pregnancy and parenting and birth provider resources on this channel in addition to our other social channels. You can find us on Facebook at Anja Health, on Twitter at Anja Health, on TikTok at Anja Health, and at Kathryn Anja. That is my personal TikTok where I talk about Anja Health. You can also text us at 310-620-1663. Yes, it is always a real person. And lastly, we have a free community for those that are interested in pregnancy, birth, or cord blood banking. So you can join us there at anjahealth.com/community. And then lastly, we have a podcast, the Better Birth Podcast by Anja Health. So we would definitely love to meet and see you on any of those channels, whichever one is your favorite. Once again, thanks for watching and hope to see you at our next video.